Good afternoon, YME community. Superintendent Rich Schneider, joined by Crystal Enninga on your weekly update. Let me share my screen. And so we can kind of review some things. Last night we met, and you should have gotten a letter last night kind of explaining for the next 2 weeks we will be in distance learning. So let's kind of back up a little bit and kind of visit, why are we in distance learning? So this is your weekly update. Remember, these are our priorities. And so when we decide things, we're going to prioritize student and staff safety. We're going to worry about the community too. We're not saying we're neglecting them, but that's our primary. Before learning can happen, we need to ensure that we have safety. So here's our county case rate. This is based upon 10,000 people. So Chippewa County topped out the area over there on the far right hand column, 115.74. They will start to slide down a little bit next week, but not a lot. As you can see, we went down a little bit, but that's not very indicative of what's currently happening here. You can see surroundings. Candy Ojai is quite high. Lyon, I think, is going to pop up here pretty good. And you see Redwood has jumped up quite a bit in just that week's time. Also, keep an eye on Renville County. So we'll talk about that as we go forward. So that puts us deeply in the recommended policy for that 14-day of elementary and hybrid and middle school and high school in distance. That's in their recommendation, but we need to look at our data. In fact, right now, what they're kind of telling us that this 14-day and these thresholds are valuable, but it's really not valuable for the 2-week-old data. We need to know what's more happening right now in our communities. So look at the number of counties in each range. You can see that things from the very bottom there, that things are shifting to the far right. We met with the governor this morning. He did a webcast with all of us, and he talked about how it's surging in the state of Minnesota, something fierce. And so I also met with the local healthcare provider and talked about what's happening in our community too. So it's happening everywhere. Minnesota cracked over 5,000 cases today. So we are growing quite rapidly in terms of the number of cases. Here's daily, and again, this is from yesterday. I didn't update it for today, but I can tell you, I believe all 3 of these counties were in double digits today in terms of new cases. So that will add to our current caseload. Countryside's public health, that dashboard, great source to go to. You can watch it just like I watch it. I would encourage you to do that. The active cases, what I really focus my attention upon, it's 83 in Yellow Medicine County. That grew by 42 and more than doubled in the past week. And active cases are those cases that are in the first 14 days after testing positive. So you can see it is spreading in our community of unknown and known origin. Schools are not separate. To the best of our ability, we hope that's the known communities. So we know that they're happening right here. And this is the percentage of cases and where they're coming from. And this is for the whole Countryside public health catchment area, the entire area. So that involves more than just Yellow Medicine County. Active cases, as I said, Yellow Medicine County grew to 83 from last week, a growth of 42. Chippewa dropped by 43. I think that's going to be slow. I think they're going to pop back up again next week. Don't know for sure. Lac qui Parle, a much less populated county than ours, but they grew by 10. That's significant. And here's what's making me nervous about what's happening in Renville County. They grew by 38 in the past week. Granted, we grew by more, but their 38 in terms of their population is just as bad, maybe even a little bit worse than our 42. Staff and student data as of yesterday, total impacted throughout the year grew by 11 to 70 in the past week. Positive cases grew by 2 within our staff members. Total student COVID-related absences in BRE grew by 2, and middle school, high school grew by 6. So, and the hard part is we know that some people probably aren't reporting this to us because we're already in distance learning for this week. Total student positive district-wide grew by 1. We have several tests pending at this point. We'll see. Hopefully they come back negative. Staff information, BRE staff out due to COVID. That would have been as of yesterday, so that would have actually been today's number, 8. So we got 2 back. Middle school, high school staff absent due to COVID. We got 1 back. District staff absent due to COVID. One of those actually came back, and so we still have 1 out. Staff related to activity, both of those returned, so that's not impacting our activities at this point. Unfilled substitute positions for next week. We always talk about that because that was one of the major factors that we used in deciding to go distance learning for these 3 days. BRE unfilled positions are 4. This is for Monday. And middle school, high school, this was as of noon yesterday, was at 2. And I don't know, Cass, Crystal, if you've looked at this yet or not, if you know that it's changed. No idea?
No, I can peek here while you're going through the rest of it.
Okay, so then it grew by 5, the number of people that have had staff-related absences, and those staff members that have been out multiple times grew by 9. And remember, we're looking at different things. We don't scrub, so they don't know that they're perfectly accurate. I spend the better part of a day trying to put this data together. I don't know really how to get more accurate data, so I'll just keep doing the best I can to give you as much information as possible. Student information then currently active in the high school, that means they're still in that 14 days, is 12. That decrease, our total enrollments 382, 74 people are in distance learning. They are electing for distance learning in grades 6 through 12. Enrollment then is actually 310. It says there, obviously my math is not too good. That obviously should be 308. But that's what we have there. BRE, there's 4 cases, active cases at this point. Total enrollments, 295. Distance learning, just like the middle school and high school, they're all in distance learning, but there are 26 students right now that their families have elected for distance learning. And remember, just to remind you, distance learning can be elected by any family. That's right in the rules, so the guidance that we get from our Department of Education. So, moving on to attendance, I'm not going to spend much time on here. I didn't actually update it for this week because we actually take attendance based upon students engaging in the online learning, so not a real accurate representation. Part of the reason now we're going to start seeing a little bit of impact with our attendance on flu-like symptoms. And we have to kind of consider flu-like symptoms in there for a variety of reasons, but generally speaking, a student or any staff member that has flu is also especially susceptible for COVID. So, and the 2 of them working together, healthcare professionals tell us, and they mentioned this today on our call, is that that's a double whammy and that can really compromise someone's health. Here's a look at our zip code data. So you can see Granite Falls grew by 19. Basically, you can go down there and see that everybody is growing. So you can see it is spreading out here in our community. That's kind of indicative of what's happening right in our region. Montevideo didn't grow as much as they did the week before, but it will likely be a little bit short-lived as I'm starting to see their numbers pop back up again. So they're going to probably peak again because the 2 communities mix quite a bit, and so that contributes to it. Here's predicted for today. When we were doing our math, we thought we would be at 43.31. That's what we told you last week, and actually we came in at 44.31, so it grew just slightly. Chippewa We thought we'd be at 114, and we actually came in today based upon our data at 116.51. So pretty high there. Expected for next week, there's what concerns me, is that you can see that we went up by about 50 or about 40, excuse me, 40 cases. And so that's a little pause for concern. Chippewa went down. Like I said, I'm pretty certain that'll be short-lived. I could be wrong. Though, so then real time, what we're living right now as of yesterday was 83.59. That's the highest we've ever been. Chippewa will drop down to 73.99. Again, I don't expect them to stay there. And I actually am a little afraid that we could go higher than 83.59. So just a little background. Sometimes we don't, so the problems associated with COVID affected and infected students. So affected would be a student that's put in quarantine. MDH is very adamant with us, and we have to follow these guidelines, otherwise we'd have no rules. We have to follow their guidelines. If we don't have the students here, of course, they're not going to be quarantined. So we have to remember that when we kind of look at those numbers. So we can't rely upon them solely. The reason we make our decisions based upon 2 weeks at a time is basically what we're trying to do is to get through a two-week, what they call incubation period. So it's 14 days of quarantine for a positive case. And that basically gets a person out of the infectious period. So that's the rationale. The Department of Health is recommending that that's what we do because that's how you try and flatten the curve to the best of our ability. We do know, and I have heard from several of you, it is tough when we keep popping back and forth. I'm sure what a lot of people are thinking, and I share with them, is that it's hard to make a decision each week. I think what I hear though is they really want the kiddos back. And so if we were able to come back, they don't see that that 2 week is a problem. If we're going into distance learning, they have a concern with that. Well, I'm going to base my decisions upon the regional support team and the Department of Health. So I know that's challenging. Please know that that's not lost on any of us. This week, they put out information about the definition of hybrid learning. So we'll take a look at our hybrid learning plans, and we might have to do some adjustments on how we can do it. We did the best we could to bring kiddos in as much as possible because that's what we heard last spring in our surveys. And so we tried to do that. Unfortunately, when we do that, we're going to have to occasionally flip into distance learning. That's just how it works. And we believe that that suits the needs of the majority of our parents. I know it's challenging for all of you, but basically at this point, that definition of hybrid learning is only a record-keeping situation. We'll call what we're doing in-person learning. We will have enhanced health protocols to go along with that. We may look at a different model or some different adjustments to our hybrid learning and how that might look. So, but at this point, it's not causing us to change what we are doing. So, multi-system inflammatory syndrome in children. You probably have heard of a neighboring student that has that. That's bad stuff. That's pretty rare, but it is very bad stuff. And I hope you folks can support that family over there in the McRae School District. That young man is really battling. That's bad stuff. The people I know that are in healthcare said that that's just something that a lot of people struggle with, or not a lot struggle with, but when you do get it, it's that severe. I guess I don't know how to explain how severe that is for that kiddo. So just wanted you to be aware of that. Regional support team meetings. So I met with them yesterday. We had the Department of Health, Countryside Public Health, Upper Sioux Communities, COVID coordinator, myself, and our school nurse. We talked about all of our numbers. And what we looked at is community spread is impacting our schools. We have surge in our community right now. We are living it. The state as a whole is experiencing a surge. Well, how does that affect us? Well, there's only so many beds available. The governor said we are pushing the limits of beds, and he may have to make some decisions, and he didn't really allude to what those decisions would be, but it might be about finding a way to carve out more beds for people that are grievously ill with COVID. The positivity rates are increasing. So a positivity rate is the number of people tested that are positive. We were, I believe last week we were at 5% positivity rate as a state and as a county. This week they're telling us we're at 11%. What they're telling us is that that's probably an indicator that there's more COVID out here than we realize. So we just have to be cognizant of that when we make our decision. Southwest Minnesota is surging as a whole. We are reaching some of our highest levels that we have been in. Flu season is just starting. They warned us that we should expect a surge in October or November last spring. If you roll back and listen to what they were saying, that's what we're living right now. We're spending more time indoors, more time with each other. That's causing it to spread. Waiting to make a decision when the cases are in the building will be too late. By the time we get them in the building, those students that are showing symptoms, we're going to have to go back 2 days to figure out who they were exposed to. In some cases, that's going to be challenging for us. So it will be too late and we'll be even deeper into the surge. We can impact it. All of the medical people I have talked to have said we can impact what's happening in our community by not gathering socially, by keeping our distance, and wearing our masks at all time. If we want to be able to come into school or to have activities, we need to do a better job of complying with that mask requirement or mandate or whatever you want to say. It's just something we can do to impact it. Local health care impact. We know that we're going to at some point reach some capacity with our beds and staff. We are experiencing some spillover or expecting to experience spillover. Spillover would be cases coming to us from either the metro or other regions, maybe Sioux Falls, South Dakota, as part of our healthcare networks. We know they're going to spill over in here. And so that's what our healthcare providers are telling us. It was clear yesterday, no qualms about it. They recommended that we remain in distance learning for 2 weeks. They didn't pull any punches. They told us straight out, that's what we should do. And so last night at our incident command team, we voted and we decided that we would be in distance learning for 2 weeks. And so I know that's hard for you folks. We'll do the best we can, but 2 weeks is what it is at this point. Okay, let's start taking a look at some of these questions.
All right, let me get back to the top here. Okay, so I just want to mention that I'm going to kind of rephrase some of these because there are a lot that are not really directed as a question, more of a statement. So I am going to paraphrase and rephrase a few of those just so you're aware.
Okay.
Since working parents have to continue to work, are teachers going to be expected to be available for student help in the evenings when parents are actually getting around to doing the schoolwork with their child?
Yeah, that's going to be tough to do. I'm not saying teachers aren't working in the evenings. They probably are working a lot of evenings. We're not going to flex their time because still for the majority of people, it does work for that education during the day. So we're trying to do some things. And I know I'm going to jump ahead to a question that's kind of related. I think some people are feeling the overwhelming amount or quantity that's being expected of them. We've talked about that. We're learning as we go here. We're going to adjust. So I've kind of asked the principals to kind of oversee. Let's make sure this is manageable for our families if the quantity is too much. teachers aren't trying to dump on, they just don't know. So reach out to your teacher or your principal and ask them about that, what we can do to work together better.
Yep. Okay, so what happens if a family refuses to complete the distance learning assignments?
Okay, that's an option for you. That's always, of course, an option. Of course, it will impact if they're a student that receives letter grades, their letter grades. We want them to comply, but I'll revert back to please communicate with the teachers. They want to work with you folks. They might not be aware of certain situations. They want it to work, and so do our principals, and so do I. We all want this to work. So we do need to adjust some.
Yep, absolutely. Um, this is kind of wrapped in that same question, but how will you be accommodating the households that have two full-time working parents with young children?
Yeah, that is challenging. We're trying to do
Yeah,
the best we can. We'll adjust. Again, you got to contact those teachers and see if they can adjust. We'll do the best we can, folks. We know it's overwhelming, especially for the two working parent families. It is hard. Unfortunately, there's probably going to be some work at night, um, even if they're in sync here.
right. That's kind of my obligation as a parent. I get to come home, I get to do a full
Yeah.
day's work, make supper, and then I'm with my kids doing work. And I'm in the same boat as most of you guys as well. So it's
Yeah,
not
I
always the
lived
best,
it
but
too
it's kind
when my kids were that age too. And that was
right,
the COVID time. I don't know,
right.
maybe my students were slow at getting their work done, but every night we had to do some homework.
Yep.
And I realize it's a lot more now than it was then. But it,
Yep.
right, it's a challenge for everyone.
It is. Um, Question regarding the school calendar and why isn't the school calendar being extended into summer and instead we're taking these days off to relieve the burden of distance learning on the parents?
Okay, so we aren't looking at going into the summer right now at this point. Of course, that could happen.
Right.
Um, I don't have a crystal ball. I'm kind of hoping that we can come up with a vaccine and maybe have an impact on this. Um, maybe herd immunity is going to help a little bit too. I don't know. I don't have the answers for that, but we're not expecting to go into the summer with our calendar. I would think that many parents would be opposed to that. I remember when I was a high school principal, it was not met with very favorable reactions when I said that, hey, maybe we need to make up this credit during the summer. So I can't imagine that students are going to want to do that. But who knows what will happen? Some of this stuff is outside of my control, and that would probably be one of
You'd cut into my lake time. I don't know if I'd like that so much.
them. Yeah.
Okay, so there have been some rumors apparently spreading through town, and that we went into distance learning last week because the teachers were quote unquote too stressed to teach. It has also been rumored that teachers have threatened to strike over their working conditions, therefore causing our previous changes to Fridays, where the day was either eliminated or shortened for the students. Are either of these rumors true? Start
No,
close.
they are not true. Are they stressed out? Yes. Okay. I know just like you folks, we're all stressed out. I know I get emails from Crystal late at night. I know she's working late. Everyone is stressed out. There's a big burden on all of us, and teachers are part of that. When I talk about the stress of teachers is teachers normally only taught in person, and now they have to worry about distance learning kiddos too. That's what's unique. And I want it to be clear, no one has ever threatened to strike. That's not been said. Our teachers have been troopers. Um, eh, I just can't say enough good things about what they're doing. So
Right.
we want to be problem solvers, folks.
I know firsthand that the team that we have at Burnt Rainey and in the middle high school, our staff are solution based. They want to find the best way possible to deliver the proper education to the kids pre-K through 12. And they are literally doing anything and everything they can to learn different things. They're probably sitting on their phones, laying in their beds at night, searching Pinterest and how to use this, interactive feature and all of these different things. So I know firsthand
I
that
hope
it is
not Pinterest. I hope not Pinterest.
Pinterest. Oh, come on. There's a lot of great stuff. Either that or TikTok, Rich. And I don't know if you want to go into that black hole. So, okay. So the next question, how can the school justify implementing distance learning, yet sends out emails promoting winter sports like basketball and wrestling?
Okay. That is something that is allowed in the rules, and I realize that frustrates people and they want me to take a political stance, but I can tell you when we've talked about it at the incident command team, there's several people on there that are very passionate about continuing these activities, and in their defense, they're saying it's because it helps and gives their students an opportunity to socialize or to work as a team and maybe alleviate some of the pressures related to mental health and some of the anxiety with isolation. And I understand that. I'm kind of torn with that. The problem is I know that it could contribute to some community spread at some point. You'll probably hear at some point that maybe some student came here to our building and from another team and was COVID positive. That's likely at some point you're going to hear that. So I know that happens, and maybe it shouldn't be as big a priority, but for some students, that's what motivates them. So I try and reach a fair balance.
Yep. Have there been any discussions about a new hybrid schedule so that our elementary students can go to school in person part-time?
Yeah, that's one of the things I talked about with that definition of hybrid. We will take a look at that, but I don't know that that's going to make parents much happier either. If I've got to leave half of the students home every other day, I don't know that that's going to help those parents that have two working parents. That's why we decided to do what we do, keeping the kids here the majority of the time. But this is the cost sometimes that happens, is sometimes then we have to be able to go into distance learning. There's got to be some give and take here. So that's why we chose the model. But yes, we will be looking at that as a change. And it's constantly in a state of flux.
Right. Next question is, are the surging cases that you are referring to school related or community related? I know you touched on this, but I do want to just mention as well, I want to make sure people are understanding that our job is to avoid cases in our buildings. I mean, so we're trying not to get these numbers elevated. So when you're seeing, we've got one positive case, we've got two positive cases, that's good. I mean, that's a good thing. And I think people are forgetting that. So back to the question, sorry, I had to get my 2 cents in there. Will our surging cases that you are referring to school related or community related?
They are both. All right. So at this point, like I said, we have some pending cases out there amongst our staff and students. We'll see how those come out. I don't have a crystal ball. One area around here, just so we can talk a little bit about positivity rate, one regional area around here, they are kicking out 51% of their cases are positive. That's terrible. All right. That's unacceptable. They've letting it get too far. The advantage of that we're trying to do is to get ahead of it. If the kiddo shows up with COVID, it's gonna spread. All right. Have we been able to identify for sure? If everybody could identify the source for sure, and we could always eliminate it, we'd have this thing under wraps right away. We don't know for sure. Quite a bit of it is community related, but the school is woven into that community. So we are likely seeing the same, maybe a little higher percentage. The reason I say a little higher is oftentimes we have students that are COVID positive and we don't know about it. And some people are refusing to test, which I suppose that's your option.
Right. Okay. Question regarding masks. If masks are effective, then why, if one student or staff tests positive in a classroom, then why does the whole classroom need to quarantine for 14 days? And how many subsequent students and staff have tested positive during that quarantine period?
We have probably had from those quarantines, those classroom and bus quarantines, we probably have come up with 4 or 5 positive cases as a result of that while they were in quarantine.
Yep.
That's exactly what quarantine's supposed to do. And they were mask compliant, those people.
Yep.
Masks work, meaning when they work, they don't eliminate the possibility, they decrease the possibility.
Right.
If we didn't wear masks, it would spread pretty fast. So,
Yeah, those 4 or 5 positives could have turned into 15 to 20 very quickly if they were not mask compliant.
correct. And I can tell you for sure that some of those people were very symptomatic to
Yeah.
such an extent that they really couldn't work.
Yep. Okay, so now last question is in regards to staffing. Obviously, staffing has been a major issue and a concern in both of our buildings, but does it help at all if BRE would stay in person and the middle high school would go to distance to spread the resources around to cover BRE so our littlest learners could be in person?
Correct. And that's what we did the first time we went into distance learning. So we try and do that as much as possible. Last week, we were just at a breaking point where we didn't have enough to cover either building. We'll continue to look at that as this goes along and as we get better information. But at this point, our focus is to get our youngest learners in. Now, I will tell you, I do get criticized because I'm not thinking about how this is impacting the mental health of our high school students and middle school students. I agree, it is impacting them, and please reach out. We've tried to put together some resources on that, but please reach out and we'll try and do what we can. I don't believe the only solution is bringing the students in. I believe that is a solution, and if I could, I'd have them here every day and we'd play every ball game and let our students hang out as much as they could. But I just don't think that's wise at this point, and nor does our regional support team. All right?
Yeah.
All right. I don't know if we'll do one of these next week or not. I can't. We have a board meeting on Monday night. We'll talk about whether we'll have an incident command team meeting next week. If we do, it's probably just to talk a little bit about the data. And if there's not a dramatic change, I wouldn't expect one out next week. But if there is, we'll mail it out to you. All right, folks, be safe, mask up, and please practice social distancing. Thank you.
Thank you.